It is a condition of oak striae, vertical lines in posterior trauma of descendant membrane of cornea, which is disappear with pressure. Etiology of this condition, it can be seen in keratoconus and may also seen in normal corneas. Risk factor of this oak striae is basically a rubbing of eyes. Symptoms can be the patient will complain of ghost images and shadows of vision. In CITLAM, you can note for vertical lines in posterior stoma. Other investigation, you can go for a topography that will refract with a decreased thickness. And also you can take anterior segment OCT, define the thickness of striae. And the management of this condition, treating the underlying causes, which is keratoconus. Differential diagnosis of this oak striae, it can be misdiagnosed as a descendant fold.